Sleep and rest. As we age, our sleeping patterns change quite a bit. We might become sleepy earlier, wake up earlier, or experience less sleep than when we were younger. Difficulty sleeping is also more common as we age, and the causes can include a number of reasons that we can work on. Waking up tired or an inability to sleep are not a normal part of aging. Sleep and rest are very important to our physical and emotional well-being. A good night's sleep helps us to concentrate and remember. Sleep helps our bodies to repair cell damage that occurs during the day and refreshes the immune system. Lack of sleep can contribute to health problems like overeating, obesity, diabetes, and breast cancer in women. If you have problems with sleep, a first step is to explore the possible causes with your healthcare provider and with a support partner who can help. Older adults need just as much sleep and rest as younger adults. However, older adults tend to go to sleep earlier and get up earlier. Typically, 7 to 9 hours of sleep a night is what is recommended. In this presentation, we will be looking at the benefits of sleep to include reduction of stress and improved immunity. We'll also be looking at some symptoms of sleeplessness, causes, and some ways to improve your sleep. It is advisable to explore the possible causes of sleeplessness or poor quality sleep with your healthcare provider. A first step, however, is to be able to recognize poor quality sleep and accept that you may need help with sleeplessness. These are several symptoms that may indicate you are experiencing sleep difficulty. Think about if any of these symptoms are things you are experiencing and take the next step to get some help and some needed rest. Just because we're getting older doesn't mean that's why we're tired all the time. Getting a good night's sleep has many benefits, as you'll see in this presentation. There are also many causes for sleeplessness that we'll also touch on. A good night's sleep helps us to concentrate and remember, helps our bodies repair cell damage that occurs during the day, and refreshes the immune system. Lack of sleep can contribute to health problems like overeating, obesity, diabetes, and breast cancer in women. If your body doesn't get enough sleep, it can react by producing elevated levels of stress hormones such as adrenaline and cortisol. Deep and regular sleep can help prevent this. Long-term or chronic stress can overexpose your body to stress hormones that can disrupt almost all of your body's processes such as depression and anxiety. Finding healthy ways to cope with stress can lead to better sleep as well as improved health, uplift in mood, and more energy. One last and most important point about sleep and stress is the impact on the cardiovascular system. Developing a healthy regular sleep habit can help to lower levels of stress and associated inflammation that can damage the heart. We all react differently to stressful situations. Stress is a fact of life. How we deal with stress can make or break us. Finding ways to help manage stress might include investing time in healthy relationships or socializing, finding a walking buddy, or finding ways to laugh more. If you look hard enough, there's bound to be something or someone that makes you chuckle. That's a start. Getting enough sleep helps improve memory and processing thoughts. Have you ever noticed that when you're tired, you just can't remember things as well, like where you put your keys? Individuals with Alzheimer's disease may develop changes in sleeping habits. Some people with Alzheimer's can sleep for a long time, while others may not sleep enough. Getting up several times throughout the night may also be an issue that can certainly affect sleep. Having higher blood pressure increases your risk of heart attack or stroke. Getting plenty of quality sleep helps the body to relax, and that can help reduce blood pressure and generally keep it under control. While you're sleeping, your body is strengthening your ability to fight infections, especially during allergy, cold, and flu season. For example, if you're feeling a bit run down and don't want it to turn into a cold, go to bed early and try to get lots of rest. The key is to allow yourself some added sleep and rest with no added guilt. Have you ever been so tired you find yourself snapping like a turtle for no reason? Lack of sleep can make us more agitated, so we're more likely to snap back at the bank teller or be grumpy with a friend or loved one. The better you sleep, the better your ability to stay calm, controlled, and reasonable. We said earlier that you first need to recognize you may have a problem with sleep. If any of the symptoms we share describes you, a next step is to think about the underlying problem. Stress can cause these problems, and depression can also contribute. Have you had a recent experience that was very stressful or traumatizing? Are you taking medications that can affect your sleep? Do you struggle with anxiety or worry? These are areas that the Afresh program can help you with by providing counselors and coaches that meet with you to help you form a plan of action for improving sleep. Let's take a look at some possible causes for sleeplessness. According to the National Sleep Foundation, sleep apnea is a disorder in which brief interruptions of sleep occur. People with sleep apnea have short pauses in breathing while they're asleep, and these pauses can happen many times during the night, making your days a lot longer. If sleep apnea is not treated, it can lead to other problems, such as memory loss, stroke, or high blood pressure. You can have sleep apnea and not even know it. Feeling sleepy during the day and being told you are snoring loudly at night could be signs that you have sleep apnea. You may need to learn to sleep in a position that keeps your airways open. Treatment using continuous positive airway pressure, CPAP, device almost always helps people with sleep apnea. If you think you might have sleep apnea, please talk with your doctor on how you can manage this condition. Your pillow will thank you. Insomnia is a difficulty in falling asleep and staying asleep. Insomnia is the most common sleep problem in adults ages 60 and older, and it can last for days, months, or even years. People experiencing insomnia can feel dissatisfied with their sleep and will usually experience one or more symptoms, such as fatigue, low energy, difficulty concentrating, mood disturbances, and decreased performance in work. If you think you have insomnia, please check with your doctor on ways to manage this condition. On the next few slides, we will take a look at some things you can do to get a better night's sleep. Along with good sleep at night, it is also important to feel calm and relaxed while awake during the day. Benefits of sleep, rest, and relaxation include clearer thinking, quicker reflexes, a strengthened immune system, better memory, weight control, and a sense of ease and balance in life. Let's take a look at some things that you can do to improve your sleep. Physical activity and exercising daily can help us get a better night's sleep. Be sure not to exercise close to bedtime, however, as it may keep you up at night if you exercise within a couple hours of bedtime. Tire yourself out, but be safe and smart about it, and the added benefit of regular exercise helps too. Having a healthy diet and avoiding those nightmare television watching snacks may be adding to the lack of quality sleep you are experiencing. Especially avoiding processed foods or foods high in sugar may help you sleep at night. Some people experience sleeplessness with the nighttime alcohol, so be cautious overall of what you consume close to bedtime. Being consistent with our daily wake-up times as well as bedtimes can help create a ritual that our body will get used to. You may be an early person and do better in the morning than in the evening. Getting up around the same time in the morning, especially if it's early, may help you go to sleep at night when you hit the pillow. If you are a night owl and do better at night than in the morning, try to stick to a consistent bedtime as well. It's hard to wind down at the end of the day, but creating an atmosphere for sleep might be just what the doctor ordered. Try to avoid using computers or other devices before bedtime. You may sleep better with a nightlight or complete darkness. You may need soft noise like a fan to help you sleep. Adjust your surroundings and think of the things that you can do for a better night's sleep. Some people find that power naps during the day are helpful in recharging energy levels. Some people, it might take 2 to 3 hours to even fall asleep for a power nap, not making it powerful or a nap at all. However, finding time in the day to rest, meditate, or turn things off like the TV, radio, and your mind might provide the needed rest during the day to keep going. A couple key points or takeaways from this presentation are simple. 1. Waking up tired every day may be a sign that it's time to see your doctor. Don't hesitate if you think you may need some help with sleep. There may be an underlying cause that is preventing you from a good night's sleep, and your physician may be able to help you. 2. Finding healthy coping mechanisms can improve sleep, and sleep can improve your health. So often, we just accept or deal with the fact that we're not getting good sleep. Remember, anything that is unhealthy and chronic will eventually get the best of you. Good night and sleep tight.